They're taking away the money for us to educate our students as they come through and to train people to do the jobs that we need them to do, and they're shifting it over to these tax breaks. An additional $264,000 in tax breaks to people that have $1 million coming in every year. Not if they've accumulated over their lifetime, but if they're getting in $1 million a given year, the Republicans would give them an additional $264,000 tax rate. And they would pay for that by not taking care of all the things that this country needs done to be strong and competitive and provide opportunity. And they would pay for it by going after Medicare. And that's the one thing you probably heard the most about over there. But after working a lifetime, after paying into the system, after knowing that you think that the reason you did that was that when you retire, you're going to have the security of knowing that your health care needs would be met by a system that's been proven to be very, very good and effective. We can always improve it. We can always do it more efficiently. We can always make sure there's less fraud and waste and abuse in any system, including the health care system. But it's been working really well. 98% of the money in Medicare goes to health services. Only 2% of it goes to overhead. So that's quite a bit better than the private insurance companies are doing out there. But the Republican plan and Paul Ryan's plan in his budget would say, well, we're going to change that. We're going to take what's working well, and we're going to save the program money. Now, it sounds good. Everybody wants to save money. But what they're really saying is we're going to shift all the cost of the program onto the individual. Back to our friend Ayn Rand. I'm going to get on that. What used to be a program that you had a guaranteed set of benefits, they want to switch over to that you would get a voucher. The voucher wouldn't quite pay for what is now the basic set of services. And the Office of Management budget and other people look at it and say, and every year, they may increase that, but they're not going to increase it as much as the cost of health care goes up. So their estimates, the Office of Management budget, the Economic Policy Institute, say, before long, people are going to be paying another $6,400 out of their pocket.